Good morning. We have Sara Bandy joining us from Blue Valley Physical Therapy. Good morning, Sara.
Good morning. Thank you for having me on.
Thank you so much. So would you tell us what the difference between OT and PT is, and do you need a script for either?
Good question. So PT is physical therapy, OT is occupational therapy, and by definition, physical therapists work with more gross motor, so like the shoulders, the legs, the arms, the hips, the back. Occupational therapy by definition is fine motor, so more wrist and hand movements. You do not need a script to come to physical therapy. Kansas is a direct access state, so you can come directly to a physical therapist. Occupational therapy is a little different. You do need a script for occupational therapy.
Very good. Thank you for helping to understand the two differences. So there are a lot of people that are getting out with the stay at home, trying to get some physical activity in. Are there any specific stretches that we should be thinking about before getting out for our walks or our runs?
Good question. This could go, this could be answered a lot of different ways. To sum it up though, functional mobility is always going to be better than flexibility. So I get asked this question a lot, and a lot of it is, my answer is going to be, you need the flexibility of the muscle and the joint for what you need to do your activity with. So research has shown that actually statically stretching a muscle doesn't actually prevent you from injuring that muscle. It's just the opposite. So sometimes doing more of a dynamic warm-up, maybe some squats, maybe some leg kicks, maybe some band walks, maybe just kind of getting the muscle warmed up is better than doing a long static stretching to a muscle.
Very good, Sara. Now that we understand a little more about physical therapy, is there a certain time frame, or how will I know how long I'll need therapy?
Oh man, you were asking all the good questions. So that is definitely patient specific. I like to think of ourselves as tissue healers. So every diagnosis that comes in our door has a certain tissue. Maybe it's ligament, maybe it's bone, maybe it's cartilage. And so the timeline for healing of those tissues are all going to be different. And so it's really hard to say, oh, you need 8 visits, or you need a month, or you need this. So we definitely are very tissue specific in our diagnosis and our treatment plan. Our main goal is to obviously get those patients back to their independent home program and back to feeling better and healed. Someone who has surgery and someone who's dealing with something very chronically, it may take a couple months. On average, we see patients in the clinic about 2 times a week, and most patients are done with therapy in about 4 weeks. But again, that's going to be very tissue specific. Besides actually getting the tissue healed and then getting you pain-free, our big goal is prevention too. So we want to be able to give you exercises for preventative care too. So if this happens to come back in a year or another year, then you know what to do and prevent it from actually re-injuring.
Sara, you've given us such great information this morning. We were able to do a ribbon cutting at your office, and you have beautiful offices. Tell us, how do we get a hold of you?
Yes, thank you. That was so fun. And that was right before all the COVID things. So I was so excited that we were able to get that down and you guys were able to see the clinic. You can reach us at on the internet. You can bluevalleypt.com is our website. Our clinic number is 913-789-0888. And those are the best 2 ways to get a hold of us.
Thank you for joining us this morning. We're very honored that you are an NEJC chamber member. Thank you. Stay healthy and stay well, and hope to see you soon.
Thank you so much for having me. Thank you, guys.